Good day, I'm Joyce Aradi Montefalco from BSN 25 and I will going to show and perform to you what is bag technique and its purpose. Also, what are the materials that we need to put inside the bag. So what is bag technique? A bag technique is a tool by which the nurse during her home visit will enable him or her to perform a nursing procedure with ease and deftness. It is also an essential and indispensable equipment of a public health nurse which she has to carry along during her home visit. Before we perform a bag technique, remember, upon arriving to the client's house, make sure that you greet and introduce yourself to the family. Then assess the needs of the patient. Next is to establish rapport to the family members to promote cooperation. Third is to identify the client and explain the procedure to be done. Fourth is to take the client's history. After that, ask them if they have any flat surface like table, chairs, or backs. Oh, or if none, use the floor. This is where we perform a bag technique, or it is the place where we perform bag technique. So here is the table where we perform a bag technique since it was only available on the client's house. So first procedure is to open the bag and bring out the paper lining. Place the paper lining on a flat surface of the table. Then, bring out also the plastic lining. And place it just above the paper lining. The purpose of this is to contaminate all the materials that we will be used during the nursing procedure. Then after that is we place the bag on the left side of the plastic lining. Then put the strap under the bag. Next is to open the bag and bring out the soap with soap dish and towel. Then close the bag without locking it and perform hand washing. So after hand washing, put the soap with soap dish and towel on the right side of the plastic lining. Then, after that is put on the apron and observe proper technique. This is to protect the uniform of the nurse during the nursing procedure. Then after that is remove from the bag articles the needed materials for care. So make sure that you place the needed materials on the plastic lining. After that is bring out also the paper receptacle outside the working area. Then, after that is close the bag and complete care. Perform aftercare of articles used. So usually, it is disinfect using the alcohol. So remember that the clean area is on the left side of the paper lining or the plastic lining, while the dirty area is on the right side of the plastic lining. So all the disinfect materials will be put on the left area where we have the clean area, since it was the contaminate and clean area. So we will use the cotton ball to disinfect the needed materials when performing the nursing procedure. Then place on the left side. The cotton ball will be put on the paper receptacle outside the working area. So after we disinfect all the materials that we use during the nursing procedure, is we are now perform again a hand washing. So after hand washing, open the bag and return all articles used. Then after that is return the soap with soap dish and towel on the last part of the procedure. After that is we need to take off and fold the apron using the proper technique. So remember that the soil part is on the inside and the clean part is on the outside. Then, after that is we are now return it to the bag. After that is we need a plastic bag to where we place the towel and the soap dish. Then, return it to the bag. After that is we get some plastic bag. Then close the bag. Then pick the bag. Then after that is we fold the plastic lining. And discard. The receptacle paper also discard. Then the paper lining fold the paper lining without touching the contaminated side. And also discard. After that is we document some unusual findings when we performing a nursing procedure.